of federal funds. There's also an annual report that is associated with this piece of legislation, and this particular bill is still pending in committee. We also have SB 39. It basically allows school districts to provide preference to any agricultural products that are grown within the state as part of their procurement process. This bill is also still pending in committee, and it was also filed last session and was not passed. We also have HB 2087, and this bill would expand the role of the Interagency Obesity Council. It would require the council to develop wellness guidelines to educate child care providers, public school teachers, and public school administrators about serving as a role model for children by practicing healthy nutrition and engaging in physical activity. The council would also be responsible for developing incentives to encourage those child care providers, teachers, and administrators to follow the guidelines.
My mic is on.
We also have SB 954. This would require the local school health advisory councils, or SHACs, to conduct a review of the district policies regarding marketing and commercial advertising of food products on school property. The council would make recommendations to the district regarding the extent of marketing and commercial advertising of food products that are not part of the school meal and may be allowed on district property. This bill has not yet had a hearing, and it's just filed at this point. Senate Bill 1866 would set up the Hungry Free School Kids Award Program. It's basically a grant award program that would award 25 schools no more than $2,000 annually. The award would be for those schools for having increased amount of participation in the school programs and doing an outstanding job in the administration of the National School Lunch and Breakfast programs. The department TDA would also be responsible for creating the award process and a logo for the program. There's also a companion bill, House Bill 3894. And again, both of these bills have just been filed. There has not been any progress in getting a hearing. We also have House Bill 3290. It requires TDA to develop and implement a pilot program regarding local products in school meals. So the bill would fund $5 million to the Department of Agriculture, and districts would be able to receive an award of 15 cents per school lunch served by the district that uses fresh, unprocessed, or minimally processed ingredients directly from local in this case being Texas, farms. So this is a grant program that would operate for 2 years and would allow schools to get that extra funding for serving local products. We also have Senate Bill 1476 and Senate Bill 1374. They are very similar, little bits of different language in them, but essentially require TDA to address in their strategic plan a plan to address hunger, food, nutrition, physical activity, and obesity. And then the last piece of legislation is House Bill 3562. It requires school districts to serve meals for the National School Lunch and School Breakfast program to students without positive account balances. So in instances where a child shows up to school and does not have funds on their meal card to pay for their meal, this would require the school to offer them, to still serve them a meal. And this bill is the only bill that has moved past committee. It was reported favorably out of its committee and is on the House calendar. That is it for bills that have been filed that impact food nutrition at TDA. I guess no one can ask me questions. It doesn't sound like anyone has a mic, but if there's any, if you have a question that you want to write in, we can look at those and go from there.
Any service center out there now that can finally hear us since we got the volume issue taken care of? Does anybody at ESC have a question for Melissa?
Barney, this is Joanne at Region 16. We don't have a question, but we just got on.
All right, thanks, Joanne. All right, thanks, Lee. Any questions for Melissa? Webinar participants? Questions? Michelle, does anybody have? No? All right, well, thanks, ladies and gentlemen. Thank you, Melissa. Appreciate it very much. And next we will have Michelle Smith, and she's going to talk to us about wellness plans. Or policies, sorry.
Okay. Oh, we have wellness TAMs.
Oh.
We're Scottish today.
Yeah. Here we go. It's all you.
Thank you.
Do you want to drive, or do you want me to?
Yeah, I'll drive. I'll drive, thanks. Good morning. This is Michelle Smith with Action for Healthy Kids, and glad to have you guys with us today. Just a little bit about who Action for Healthy Kids is. Most of you probably are aware of us. We've been around for 11 years now, working on obesity from the school perspective and also undernourishment and physical inactivity by trying to help schools make a healthier learning environment. One of the things that we've learned through our experience, and this is basically what I'm going to share today as part of about a 3-hour workshop that Action for Healthy Kids has put together on wellness teams and wellness policies. So you're going to get about 15 minutes out of that whole workshop. So the most important part is how you start and go about establishing wellness policies on a campus, and that is you have to make the case for healthy schools. A lot of us that are on this call today, I'm preaching to the choir because we all believe it's really critically important for our kids to be healthy. But there is still a lot of people out there that don't see health as a priority on a campus. A lot of those are school administrators. Even a lot of other parents are still not convinced that we should spend the time on physical activity and nutrition that really is essential for our kids to be healthy. Richard Carmona, who was the 17th Surgeon General, made the quote, "Because of increasing rates of obesity, unhealthy eating habits, and physical inactivity, we're going to see the first generation that will be less healthy and have a shorter life expectancy than their parents." I think most of us have heard this before, but it is something that kind of resonates when you say it, that, you know, where your parents might not be concerned about their health, if you're talking about their kids, it might make a bigger impact. So making the case for school wellness and making the case for healthy schools is essential before we can even get into policies. We know that obesity is a national crisis. We know that there's a connection between physical inactivity and nutrition and children's ability to be successful in academics. And we know that a lot of schools have unhealthy school customs. And we need to be working on all of these issues, which we can through wellness policies. Why schools? And I know that a lot of times, you know, the schools themselves get frustrated because it feels like everything is put on them, that it shouldn't always be their responsibility. These kids need to be learning at home. And I think that's one of the things Action for Healthy Kids has really worked hard on in the recent years, is making the connection not just at school but also at home. But we can help still. The school is an environment where kids spend 1,200 hours a year, and we really have to strive to make that a reinforcement of what we want parents to teach at home, and be able to show that everything in the school is supporting activity and nutrition. Teachers, staff, parent volunteers, they're all key role models in this. And we have the standards in our curriculum integrated in on nutrition and physical activity, so we just need to make sure that it's being carried out throughout the school. and that these kids are learning what is important. And, you know, my mom always said, you know, if you don't have your health, you don't have anything. And I'm sure she'd heard that from somebody else, probably her mom, but it's true. I mean, we can either help our kids learn to live healthy lives, or our kids will grow up and end up doing nothing but managing their health. So it's really critical that we make this in schools. Action for Healthy Kids has come up with some different tools that we'd like to share and that we think can help you make that case for your schools. And, you know, the bottom line is that healthy kids learn better. So one of the things that we have, which you can download from the web link that you see here, is a document called the Learning Connection. It makes that connection between physical activity, healthy eating, and learning. And it's a pretty easy report that summarizes the most recent research proving that healthy kids are better learners. So we'll send these slide presentations out after the webinar, and we also are recording this, so it will be on YouTube, and we'll send that link as well, so you can have access to these connections. But this is a downloadable document. Some of the things that are in the Learning Connection is, for instance, there's a study of 5,000 kids that shows it's not just whether you eat or not, it's about what you eat. And it showed that there's a significant association between the quality of a diet. So it's not just, you know, if your kid has a bag of chips and a Monster on the way to school, that's not necessarily going to help him academically. He is eating something, but it's what they're eating. It's that they're getting a balanced diet. So that's one of the things that's quoted in this, the Learning Connection. Also shares information on what the impact of physical activity is. It's fuel for the brain, not just the body. And it not only increases learning ability, it increases attentiveness, it increases the level of engagement, behavior issues, and decreases absenteeism. Another study from the University of Illinois that's part of this document is this one that shows that increased physical activity leads to improved mathematics, reading, and writing, and test scores. Obese and overweight kids miss 2 to 4 times as much as healthy weight kids due to illness and social concerns like bullying. So if kids aren't in school, obviously they can't learn. And there's also a financial connection that you can make for your schools, and this sometimes has a good impact on school boards. For instance, in Austin, there are 86,000 students, and 30% are overweight or obese. Student absence at AISD costs $45 a day. And if obese children miss an average of 12 days of school per year, which is 2 more days than normal weight children, that means 12 days a year they're not in class learning, and that adds up to over $2 million per school year in lost revenue. So when you start looking at it from that perspective, sometimes your administrators start realizing that kids being healthy is maybe a little more important than they thought, not just from the kids being successful, but from a financial perspective. Sometimes it's an awareness issue. People just don't realize all the different ways that kids are getting unhealthy foods. Your school may reward students in a healthy way with certificates or small toys or recess time, or they could be using fast food coupons, popsicles, and candies. Rewards happen at many levels across the school, from the classroom, school-wide activities, PTA-sponsored events. Experts recommend non-food rewards as the best practice. Providing food based on performance or behavior is teaching your kids basically to eat when they're not hungry. And you grow up thinking, oh, I did something great, I need an ice cream, or oh, you know, let's celebrate. And we're all prone to that. You know, we grew up celebrating things with sweets, but when our children are getting these unhealthy foods from so many different sources, it gets really difficult. So we need to police this at the school level and hopefully have some policies around fewer food rewards and more things like having lunch with the teacher or extra recess time. But this is definitely a place where you can look at school policies that encourage healthy fundraisers and healthier incentives. In Texas, we have a mandate to implement coordinated school health in grades K through 8. And to accomplish this, it's important that a school sets up a wellness team. That wellness team can guide a campus on any issues that impact student health, from recess, to what's sold in the school stores, to making recommendations for brain breaks at staff meetings. And those policies can be put in place to help make any recommendations sustainable. It's nice to have a change and decide you're going to do something at a campus, but if you don't go that extra step and make it a policy, a year or two down the road, somebody forgets about it and it no longer happens. So that's one of the most important things about policies, is it really helps you put in place sustainable, healthy policies. There's also a mandate, of course, in Texas that we have school health advisory councils, and that's at a district level. And of course, those district policies all focus on school health and then trickle down to the campus. So we have a lot of good avenues in place to promote wellness in our state and in our schools. We just have to make sure people are aware and are making best use of all these. So let's talk just a little bit about School Wellness Policies 101. We can't go back and make a new start for our children, but we can move forward and make a new end. I think this is important. I mean, we start where we are, as they say, and we move forward and make things better. We didn't get in this situation overnight. We've made a lot of great progress, and we just need to keep moving forward. So what is policy? It sounds like a simple question, but what policy can and can't do is pretty complex. They can help you with your wellness initiatives, and they can help clarify what is expected behavior relating to food, nutrition, and activity at school. In general, they're the official statement that addresses the needs of a school system, a school, or a classroom. Policies usually are setting a minimum expectation, and the community values, convictions, and beliefs usually form the basis for a policy statement. They basically address what should be done, why it should be done, and who should do it. They could also cover when, where, and how related to behavior. Over time, policies play a major role in culture changes within a school or district. If you think about it, a lot of the things that have taken place over the years relating to health, from vaccinations to smoking things to seatbelts, all of those are related to being healthier, and they were all brought about through policy. So while policies can seem cumbersome at times, they are a way to make sure that we're doing the best we can to help our kids be healthy. There are some mandates around school wellness policies, and let me give you just a little bit of history which can give you context on where this is coming from. In 2004, President Bush signed the Child Nutrition and WIC Reauthorization Act, part of which required that all districts participate in the National School Meal Program has to have a wellness policy in place by 2006. The National School Lunch Program, which is a federally assisted meal program, operates in public schools. Its purpose is to provide nutritionally balanced, free or low-cost meals to children every school day. Most, but not all, public schools participate in the program. The law states that wellness policies must include, at a minimum, which means you can do more, nutrition guidelines for all foods available on campus during the day, with the goal of promoting student health and reducing childhood obesity. This includes not just school meals, but also vending, school stores, concessions, and the like. So it doesn't specify what they are, but it does specify that you should have nutrition guidelines. Goals for nutrition education, physical activity, and other school-based activities, and a plan for measuring implementation of the policy, including designation of at least one person in the district who is responsible for ensuring that wellness policy is being implemented. On the district level, that person does not have to be an individual that is exclusively assigned those responsibilities, so sometimes it's given to someone else as an add-on, but in a lot of cases, a lot of districts have assigned a specific school health coordinator. The law also requires that wellness policies be developed and implemented by local parents, teachers, administrators, school food service, school boards, and the public, which sounds like the composition of a Texas School Health Advisory Council. This provides flexibility for local schools and districts to develop policies that meet their unique circumstances, challenges, and opportunities, and allows for community input. It's important to note that although this policy was mandated as a law, it did not include funding or a method of enforcement. Please note there are currently no federal requirements for individual school policies, but in Texas we require each campus to put into their campus advisory plan how they're implementing coordinated school health and how they're ensuring that students are getting moderate to moderate to vigorous physical activity at least 50% of the time in PE class. So there are a couple of things that have to be dealt with on a campus level in Texas, which would not be the same in other states. In 2010, the Healthy Hunger-Free Kids Act expanded on the law passed in 2004, and new provisions for local wellness policies placed greater emphasis on implementation, evaluation, and public reporting for their progress. They required reporting to the public about the content and implementation of the wellness policies and periodic assessments where the results would be made available to the public. And they must now include goals for nutrition promotion. So we're providing information on where you can find more information on this if you need it. There are many opportunities to get involved with wellness policies, even though a lot of them are at the district level. The implementation, it has to happen at the campus. So there are 5 action steps you can take to get more involved at the district and school building levels. First, find and read your district's policies, whatever your school advisory council has put in place, and any guidelines that exist for individual schools. You can look for this information online, in a parent or family handbook, or in the school office. You need to pay attention to the policy language. Does it suggest, encourage, recommend, or say schools may? Or does it say schools will, schools shall, or students must? The language of the policy has a lot to do with the policy's strength. Ambiguous or vague language is interpreted differently by different people. Consider how your school leadership interprets the spirit and the letter of the wellness policy. Ask questions. Learn about the development of your district's policy, if there are things that are going on that are being planned, how they're being monitored. Find out as much as you can before you start trying to see what type of policies you might need to be changing. Look at who wrote the policy, who was involved. Did it include the nutrition department, the PE department? When was it developed? Who is responsible for implementation? Talk to the person identified as a designee in the policy and see how implementation is carried out at the campus level. Is there any tracking that happens in regards to the policy? Are there any processes in place to review its implementation? When was the last time it was evaluated? There are tools that you can use, which we'll mention in a minute, that to evaluate the strength of the policy. So find out how the policy is reviewed and how it can be revised. Then ask more questions. Are teachers and parents aware of the policy? In a lot of cases, what I've found out is there's some great policies in place, but the parents and the teachers aren't even aware of them. What about the principals? Are they aware of the policy existence and the recommendations? Are they tasked to interpret and enforce the policy at their schools? That's one of the things that our SHAC is looking at, is how we can hold our principals accountable for making sure that the policies are actually implemented at the campus level. Is the policy included in the school improvement plan? That's, we mentioned earlier, each campus has what's called a campus improvement plan and has certain things that should be included in that, and they should be published. So you should be able to find that fairly easily. This is a great opportunity. It doesn't have to be controversial. Finding out what your school has, and then making sure that you recognize for the positive things that are being done. When you have a policy that's perfect or one that needs improvement, use it. Use its guidelines as a platform for the projects that you want to implement. When you're talking to other people about your projects, mention the goals and the wellness policy that your project will help meet. If the school hasn't been meeting all the district wellness policy goals, approach school leaders and, without being antagonistic, mention that you've noticed the school might need some help implementing the wellness policy. Be empathetic about how many tasks the schools have on their plates and say that you'd like to help. Action for Healthy Kids has a very helpful tool for creating a strong and effective wellness policy. It provides a good structure and framework for your ongoing policy efforts and is intended to help anyone involved in developing, implementing, and evaluating wellness policies by providing a practical guidance on how the information about wellness policies process evolves. Successful creation of a local wellness policy consists of 8 steps shown on this slide. You can start with step 1, or you can go directly to the step that is relevant to your progress. There you'll find objectives, resources, and frequently asked questions to guide your journey through the wellness policy process. This is a tool on the Action for Healthy Kids website, and it can be used by district and school level wellness work. So another important part of wellness policy development is assessing your school's wellness environment. And I love this quote. The only man who behaves rationally is my tailor. He takes my measurements every time he sees me, while all the rest go on with their old measurements and expect me to fit them. Everything changes over time, and we have to continually assess as we evolve and move forward. Although it's tempting just to jump right into starting a project, there's a lot of good reasons to start with an assessment. First, it helps you develop relationships with key staff. Hopefully, you've already been doing this, but the assessment provides another reason to communicate and work together. Next, it will help you determine your school's strengths and weaknesses. Third, it will help you define goals that really suit your school's needs. Hopefully, at some point, these goals will go into the school wellness policy or the school improvement plan. Next, it will help you justify your decision to make changes. And finally, it will help you document a starting point in order to show progress over time. This is very important down the road, and it will help enable you to show that your efforts have achieved measurable results and create sustainability for the long term. Also, data is always useful for funding requests, especially grants. There are many types of wellness assessments out there, and your job is to do a little research and find out which one works best for your school. Some that we recommend are the School Health Index, which was developed by the Center for Disease Control and was based on the 8 components of coordinated school health that we mentioned earlier. This is a very comprehensive tool. Not only will it help you evaluate where your school stands, it will also guide you through the process of determining your priorities and developing specific goals. The second tool we recommend is a WellSat. This was developed by the Rudd Center of Food Policy and Obesity at Yale. The WellSat tool is used to measure the strength of district-level wellness policies, but you could also use it for what is or is not being practiced at your school. The third tool is the Fuel Up to Play 60 School Wellness Investigation, which was designed for schools using the Fuel Up to Play 60 approach, but could be used by any school to assess their wellness environment. And finally, we recommend the Healthy Schools Program Inventory, which was developed by the Alliance for Health Regeneration. To use their assessment, you have to sign your school up for their 6-step Healthy Schools program, and your school results are then shared with the Alliance. Look at each of these tools and decide which one works best for your school. If you're doing your project as part of a grant, you may be required to fill out an assessment or a pretest as part of your evaluation. And what that looks like depends on the granting organization, and it might be that one of these tools would be very helpful in helping you prepare for that. All of these assessments address nutrition, school meals, and physical education, physical activity. They also cover other things like health education, competitive foods and beverages, family community involvement, counseling, health and safety, school environment, and health services. The School Health Index covers the health and safety and health services specifically. Whoops, I think I went the wrong way. Nope, I didn't. After you choose your assessment, decide how you're going to administer it. Will you do it as a group? It's really helpful if you maybe split it up and have different people do it. Once you get your assessment completed, discuss the results, look for strengths, and celebrate those on your campus. Not everything is negative. A lot of times campuses are doing great things and they don't even realize it. Then decide which areas you want to address, and you can begin to start looking at what types of policies and develop a plan for how you want to move forward. How do you get a wellness team started? There's only one way to get anybody to do anything, and that's by making the other person want to do it. So one of the things that we've used that's been successful is possibly doing a SurveyMonkey survey and find out a few things about your parents and about your school staff and what type of things that they're interested in, what their strengths are they interested in school gardens, cooking demos, maybe lunchtime helping out so the kids can go outside, working on getting new PE equipment, finding out where their interests lie can help you gain a team, and it's also a good way to ask them to do things and educate them. You can use a survey for multiple things. There's a lot of steps involved in putting together a team, and we can't really go through all those today, but that's just one little tip for you there. We have a slideshow that you can download that has a lot more slides and a lot more information that you can use with your school audience. It's also available as a video, so you can have access to it that way, and it is in English and Spanish. So Action for Healthy Kids is working really hard to have all of our materials in English and Spanish. In fact, we've set up a website that's all Spanish as well, so it's accessible. It's not just part in Spanish. Everything is in Spanish. and I can send you any information on that if you're interested. So taking the Every Kid Healthy Pledge and joining over 5,000 people in Texas who are now part of Action for Healthy Kids would be great. We do a monthly newsletter to give you tips and information on different things. We also have school breakfast grants, which I think the deadline for that is approaching. It's May the 1st. But hopefully, if you're interested in that, you can let me know as well. So I hope this has been a helpful overview on policies from a campus perspective. And this is my contact information, which I'm happy to answer any questions and share any additional information. Do you have any questions, Barney?
I don't see any from our
Okay.
webinar participants. Do any of the ESCs have any questions for Michelle?
Okay. I was going to mention as well the Michael and Susan Dell Center for Advancements in Healthy Living has set up a bill tracker for all bills that are relating to school health and obesity. So it is on their website. It's Texas Ledge Bill Tracker at sph.utx.edu. So if you're interested in that, we'll also send that out to you. So it combines all of the bills I think that everybody's going to be sharing information on today, and then a few extras. So that might be helpful for any of y'all that are really wanting to track those bills.
Thank you, Michelle, very much. Appreciate it.
All right. We will go ahead and continue on with our presentations. And next I have Lori Anderson with Department of State Health and Human Services School Health Programs. She is going to visit with us and provide a legislative update on things that are interesting to school health legislation that they're tracking and following. And I figured we would pair Lori and I together here at the end because some of what she's going to be talking about and discussing is also probably similar to what I've been watching and trying to follow and share as well. So I will go ahead and get Lori. Sure. Up and running here.
Well, good morning, everybody. Like Barney said, my name is Lori Anderson. I'm a program specialist with the School Health Program in the State Health Department. Today I'm going to go over some legislation that our program's been following and provide some information on some school nurse trainings that may be of interest to everybody. So, next slide. So here's some dates of interest before we kind of dive into the legislative stuff that I want to just briefly go over. June 1st, 2015 is the regular session ending. And so that's really important because we're diving into the last month of the regular session, and anything that, with what Melissa talked about and what Barney and I are going to be talking about, there's still lots of possibilities, lots of time coming, but June 1st marks the end of the regular session, so that's something that should be on people's calendars who's following school health legislation. June 21st is also important because a lot of people feel that, their bill got through, it made it through the process, and the session's ended, so everything's good. Not true. June 21st. That is the last day the governor can sign or veto bills passed during the regular session. So we need to keep an eye on that date and anything that we're following that actually gets through after June 1st, and make sure that it gets past the governor's desk. August 31st is also important because that's the date that with any bill that does get through, if there's not an effective date written into the law, that's the automatic date it becomes effective and goes in place. Next slide. So these are some bills of note that our program actually has been following. We've been following a lot of bills, but these are the ones that we wanted to highlight for you today because they've actually made some movement in the process since day one of the legislative session. We've listed the names of the bill numbers, where they are in the process, and then a brief topic after that. If you have some interest in the details of the bills, we really highly recommend that you go to Legislature Online, type in that bill name and bill number, and pull up the actual wording of the bill and where it stands. This is all what you're seeing on the screen right now, up to date as of yesterday afternoon. Next slide. These are some two events that we wanted to make sure that school nurses in Texas were aware of. They're state level events that we will be participating in. They're open to all school nurses. My esteemed colleague, Anita Wheeler, will be there presenting with her school nurse hat on. She is going to be presenting on legal issues affecting the school nurse at both events. These events do have cost to them, and so I provided you the URLs so you could get more information on the event itself in terms of the agenda, the registration costs, and hotels and information, and get more information about the sponsoring organization. I believe Texas Action for Healthy Kids, or TEA, will be providing the slides after the broadcast today, and so don't feel like you have to scribble down those small URLs right now, and you'll get that information afterwards. Next slide. So before I actually close my presentation, I did want to mention that the Texas School Health Advisory Committee has 13 positions open. So we're really wanting some qualified applicants to get on our website. You see the web address there, the URL, and look at what the criteria is for that. If you feel that you have anybody, can you pull up the web address?
I sure can.
Well, I had it on that last slide,
Oh.
I think.
I apologize.
But do visit our website. That URL will get you to the membership application and all the criteria that's available for all those 13 positions. And for those of you on the webinar audience who aren't aware of what the Texas School Advisory Committee is, that is a state-level SHAC. And so we do have 13 positions open. That's quite a few. All of those are going to be 4-year terms that begin July 1st, 2016. So if you have any questions, you can definitely email us at schoolhealth@dshs.state.tx.us, or just visit our website at www.dshs.state.tx.us/schoolhealth.
And also on the TSHAC website here that's been pulled up, it's the very first topic that's listed right under the TSHAC acronym there. Texas School Health Advisory Committee call for applications for membership, deadline June 26, 2015. That's where you can find the information, and you can also just type in or Google search Texas School Health Advisory Committee also, and then that will take you to the main web page where you can pull that information up as well. Are there any questions for Lori, for our audience? Lori has left her chair. Any questions, ESCs, for Lori? Webinar participants, any questions for Lori? All right. Well, we'll go ahead and keep moving along here. And before I get into legislative update from a TEA perspective, I do want to mention and just kind of make a couple announcements that we are in the midst or heightened interest in FitnessGram submission time frame wise, and I just want to remind everybody that the deadline to have your data entered into FitnessGram 10 or the Physical Fitness Assessment Initiative application, whichever way your district is choosing to submit the data, is June 12th. June 12th by 5 p.m. is the deadline to have FitnessGram data submitted, and there should be in the next couple of weeks a to the administrator address letter that will be going out discussing that information as well. And then I also wanted to mention that the school health survey there will be a to the administrator addressed letter also in the next couple of weeks, hopefully going out, reminding everybody about the school health survey, and that will have the survey link to enter in all the information, and the deadline to have the school health survey information submitted is June 19th. So the following Friday after FitnessGram. FitnessGram is June 12th. School health survey deadline to have information entered is June 19th. And again, I anticipate within the next couple of weeks that there will be guidance from our agency pertaining to those two specific things. Does anybody have any questions about that? ESCs? Webinar participants? All right. My last announcement that I'd like to discuss also is in the 83rd legislative session, there was a bill passed that amended Texas Education Code 39.0545, where school districts are to look at community and student engagement and provide themselves a rating as exemplary, recognized, acceptable, or unacceptable. And there was a to the administrator addressed letter that was sent out on April 24th. And this went out, and it's just kind of reminding districts that that legislation was passed, and it amended 39.0545 and talks about the areas of community and student engagement that you would give yourself a rating on: fine arts, wellness and physical education, community and parental involvement. Fine arts, wellness and physical education, community and parental involvement, 21st century workforce development, second language acquisition programs, digital learning environment, dropout prevention strategies, and educational programs for gifted and talented. And it breaks it down and gives you, and you submit this data through PEAMS, and it gives you the deadlines on page 2 of the letter. It gives you the deadline for summer submission, reflecting the data from 14-15. It's due on June 25th. That's the first opportunity to submit is June 25th, and then the resubmission reflecting 14-15 data is July 23rd, 2015. And then for schools that are operating on a year-round schedule, your summer submission is due on June 25th, and the resubmission date for you is on August 20th of 2015. So those are the dates that information is due. And if you have any questions regarding the community and student engagement, you would need to email PEAMS customer support at tea.texas.gov, or you can contact 512-463-9704. So I just wanted to share that information with everybody. And again, that letter came out on April 24th of 2015. And for next part of our presentation, we'll go ahead and talk about the legislative session. And I appreciate Lori for providing everybody deadlines on upcoming deadlines for legislation. But to begin, when you look at the new 10-component model, if you look at the whole school, whole community, whole child 10-component model and bills that were filed this year, and again, this isn't anything that's official. This is Barney Fudge, obsessive compulsive disorder kicking in. But if you look at that model, I had flagged to track over 200 plus bills that would fit in some form or fashion in that 10-component model. And out of those 200 plus bills, I did 47 bill analyses on bills that applied to the realm of health, physical education, safety, coordinated school health, all the above. I did 47 bill analyses on those, and so out of those numbers, it's very limited so far, as you just saw with Lori's presentation. It's very limited as far as how much has really been moving, and I'll just go over just a few of those that have been moving. One of those is Senate Bill 133, which is the mental health first aid training for school district employees. That bill was reported engrossed in the Senate and is now over at the House. And so when we say reported engrossed, that means it's not enrolled, as in it's not signed into law. It's just engrossed in the Senate. Now it's moved over to the House for the House to vote on that before it becomes law. Another hot topic this year is the use of or the sale, distribution, possession, use, and advertising of e-cigarettes, and there were several different bills that were filed addressing e-cigarettes, and some of those have had some movement and have had some interest, but one of those is Senate Bill 97, and it's reported engrossed in the Senate as well and is over with the House now. So it'd be interesting to see if anything further goes on there. And then again, as always, just like last session, this session, it was another popular topic was the use of portable wireless communication devices while operating motor vehicles, and that would tie in with, obviously with kids texting or driving and safety. And House Bill 80 was amended, and it passed on to engrossment and is now over on the Senate side of things as well. Then again, another bill, Senate Bill 96. This is one of the bills that I performed analysis on. Again, relating to use and possession of e-cigarettes on school property or school-related functions. It was reported engrossed in the Senate and is now over with the House as well. Senate Bill 382. It's been reported engrossed in the Senate, and this bill was actually, it was talking about offering continuing education credit for educators that participated in any kind of training or instruction on the use of an automated external defibrillator. And so it was reported engrossed and is now over in the House side, waiting to see where it goes there. Then House Bill 440, that has passed on to engrossment and is now with the Senate, and that one actually looked at the physical education curriculum and accommodating the needs of students with mental disabilities. Any adaptive physical education program would already currently do that, but I think this was more, they just wanted it to be stated in law that districts need to make sure that they address that. So that's passed on to engrossment, is now in the Senate. Then House Bill 767 is one I did analysis on, and it's talking about cardiac assessments for participants in extracurricular athletic activities that are sanctioned or sponsored by the University Interscholastic League. And that there were several bills filed that address that specific topic, and this one particular bill has passed on, was amended, and was also passed on to engrossment in the House and is now with the Senate. And then again, another e-cigarette bill, House Bill 456, talks about possession of vapor products on school property, and it passed on to engrossment and is now now with the Senate as well. And then Senate Bill 66 is one that Lori mentioned that they're following, and is also a bill that I did analysis on, and it, as she stated, is reported engrossed and is now in the House, and that's the relating to the use of epinephrine auto injectors on public schools and open enrollment charter school campuses. And another topic of interest this year was truancy, and there were multitudes of bills filed in the House and the Senate that address truancy. And one of those bills that's been engrossed is Senate Bill 106, which is now in the House side as well. And then I'm not sure, I was trying to skim Lori's PowerPoint pretty quick, but Senate Bill 265, which relates to student use of sunscreen products in public schools, that has been reported engrossed, and is now over on the House side. And then Senate Bill 28, again, referring to epinephrine auto injectors, but it's more focuses more on the liability aspect of that for open enrollment charter school, public and open enrollment charter school campuses to have to be able to maintain a supply of epinephrine, and it is reported engrossed in the Senate and is now in the House. And then Senate Bill 69 is, I believe, was on Lori's list as well, and it is reported engrossed, and it's relating to notification requirements for a public school, an open enrollment charter school, if there is not a full-time nurse assigned to that campus, and that's reported engrossed and is now in the House. And that's all that I have as far as legislative update. Again, nothing has been signed into law, nothing has passed both sides, the Senate or the House. So it's either been passed in the House or it's been passed in the Senate and is now in its respective chamber awaiting further movement, and we'll see where it goes from there. And as far as tracking this legislation, again, you can go to the TSHAC website. They have the document there that they update. It's on the legislative page of school health programs, and they update that document.
It's updated as last week. It's up to date.
So it's up to date as of last week. Do y'all update that weekly?
We do it about every 2 weeks because things don't move as fast. Yeah.
So where would that be on the TSHAC?
It's on the school health page.
Oh, school health programs homepage. Got you.
So scroll down. Go back to legislative.
Oh, got it. Okay, so if you go to the school health programs main webpage, and over here on the left-hand side on the search bar, click legislative updates, and then you just go to the legislative update homepage, and that gives you some additional information there, definitions, and then right here you just click on that link at the top, open the document, and then that gives you information about how to use the document, and then lists all the bills that they're currently tracking, and if it's passed out of House, passed out of Senate, or voted on by Senate.
And at the end of the session, we'll have a list that will be more succinct of things that have moved all the way through the process, and then we'll publish a final list based on the veto date of the governor.
And then also how to track some of this, you can go to the Texas Legislature online. This is what, if you're not familiar with following the process or tracking it as intently as the state organizations are, this is the homepage for the Texas Legislature, and what you can do if you've been taking notes and you've been following along, what you can do is you can actually set up an account, and so you would just go to My TLO, and then you can actually make bill lists. You can make individual lists on how you're going to track this information. So you can go to bill list, and if you're a new user, then you would just click on new user and set up your account. But I actually have an account, and so I'll show you how this looks. And once you type in your information, you hit submit, and then here are the lists that I have. I have it separated out by those bills that I've done analysis on, and then those bills that have been filed that were of interest. And you can edit it or run it by deleting them, adding to them. You run the list, and then it pulls everything up, and then if you have questions or concerns, like the first one, right there, House Bill 78, relating to human sexuality education in public schools. It tells you that it was introduced, and then on February 9th, it was referred to the House Public Education Committee, and that's been as far as that bill has gone. It hasn't had a hearing, hadn't moved anywhere else, but if you want information about it, you would just click on the hyperlink for House Bill 78, go to the text, and then it pulls up the text of the bill. So if you have questions or want to learn more information about it, you can see what's been amended, and everything that is underlined is information that is new, that's being added to statute, and then anything that it has a strike through obviously is being removed from statute. So I just wanted to show everybody that and share that information, because we have talked about quite a bit of information today, and this is just a good way to track it and keep up with it. And then you can also set up alerts. So if you want to do alerts for bills, you can also go in and enter any bill that you want to receive an alert about, and I've got as many as it will allow me to hold on this page. But you can go in, set up an alert, and I didn't mark anything, so I just put any category. So at any point in time when a bill is sent to calendars or sent to committee, or has been reported, engrossed, passed, enrolled, any function that a bill goes through during the legislative process, it will send you an email, so then you can track how that legislation is passing. So I just wanted to share this information again, so you can track this information at home. Are there any questions out there for Lori, myself, Michelle Smith? Anybody have any questions? ESCs have any questions? Webinar participants have any questions? None? All right. Well, ladies and gentlemen, thank you so much for tuning in, either via TETN or webinar. We're finishing up quite a bit early today. I hope everyone has a wonderful rest of the school year, has a safe rest of the school year. And as always, if you have any questions, concerns, comments, you can email me at william.fudge@tea.texas.gov. Good luck to everybody. Have a wonderful rest of the week, and Take care.